Jugular venous pressure is the single most important bedside measurement for volume status. It reflects right atrial pressure, which in turn equals CVP, and right ventricular and diastolic pressure. Start by introducing yourself to the patient. It is important to explain the procedure first before doing any manipulation or procedure to the patient. Make the patient comfortable. Raise the head slightly on a pillow to relax the SCM muscles. Raise the head of the bed or examining table to about 30 degrees. Turn the patient's head slightly away from the side you are inspecting. Use tangential lighting and examine both sides of the neck. Identify the external jugular vein on each side, then find the internal jugular venous pulsation. If necessary, raise or lower the head of the bed until you can see the oscillation point or meniscus of the internal jugular venous pulsation in the lower half of the neck. Focus on the right internal jugular vein. Look for the pulsations in the suprasternal notch between the attachment of the SCM muscle on the sternum and clavicle, or just posterior to the SCM. Distinguish the pulsation of the internal jugular vein from those of the carotid artery. Internal jugular pulsation is characterized by undulating two troughs and two peaks for every cardiac cycle, whereas carotid artery pulse is a single brisk upstroke. In regards to response to inspiration, height of column falls and troughs become more prominent with the internal jugular venous pulsation, whereas no respiratory change to contour in the carotid artery pulse. Generally, internal jugular venous pulsations are not palpable except in severe tricuspid regurgitation, whereas carotid artery pulse are palpable. Internal jugular venous pulsation can be obliterated with gentle pressure at the base of vein or clavicle, whereas carotid artery pulse cannot be obliterated. Identify the highest point of pulsation in the right jugular vein. Extend the long rectangular object or card horizontally from this point and the centimeter ruler vertically from the sternal angle, making an exact right angle. Measure the vertical distance in centimeters above the sternal angle where the horizontal object crosses the ruler, and add to the distance 5 cm. The distance from the sternal angle to the center of the right atrium. The sum is the JVP. In this example, 1.5 cm is measured above the sternal angle. Then add 5 cm default, considering the distance from the right atrium to the sternal angle. We have 6.5 or 7 cm in total, or a reading of 7 cm water of jugular venous pressure. Here are the JVP reading values. A reading of less than 3 cm above the sternal angle is considered normal, whereas a reading of more than 3 cm measured above the sternal angle is considered to be elevated above normal. And that sums up the steps for measuring the jugular venous pressure. Thank you.